to the GW community. Today we have with us, I'm excited, y'all. Today we have with us Dr. Harold Goodman, physician, surgeon, healthcare thought leader, and author. Dr. Goodman is a recognized expert in osteopathic medicine. He specializes in osteopathic manipulative medicine, and he is based in Silver Spring, Maryland, if you did not know. He has taught and practiced for more than 30 years, and he has long been acknowledged as one of the leading figures in I'm sorry, I can't get that one, osteopathy in the Washington, D.C., Maryland area.
That's close
Misha,
enough.
can
That's
you
close enough.
please pronounce that word for me? I didn't get that
Oh,
one.
the
Cranio.
correct word is cranio-sacral therapy, but cranial osteopathy sounds just fine. And that's
Okay.
actually wording that's used. And I'm sure Harold's going to talk to us all about it a lot more. So I'm going to defer to him to describe actual terms and be a bit more accurate.
Okay.
Well, welcome everybody. Good to have you. Hope it's a good spring. There's not a lot of COVID updates, which I actually think is a good thing, right? There's the CDC there's nothing new since last week, and there's nothing new I have to say. So I'm gonna just say drop the questions in a chat as usual, but I will give you a couple of interesting factoids. So number one, so now they're talking about bird flu. So I'm putting this post in. Take a look. There's a first case of a transmission to the humans in, I think, was it Texas? We don't exactly know whether that jump is going to be real or not, but bird flu has always been on people's mind, on experts' mind, as something that will be the next pandemic. So will it be really so? I don't know, but it is in US now, which is in traditionally birds flu was always in Asia. So the fact that it's now found in a substantial numbers in animals in US should be, I think we should pay attention to that. So that's point number one. The point number two that I wanted to make is a couple of weeks ago, I recorded a podcast with a family of a dear patient of mine, Bernie, who passed away not that long ago. And he was a grandfather of a US health spa industry. And so just to kind of give him a little bit of a due respect, but also just to kind of talk about this. I find it a little fascinating of a topic all in all. And just give me a second, I'll put the link as soon as I get to my channel. The spa industry is very large now, but the way we think of a spa industry now is not exactly the same way that, for example, the Europe looks at the spa industry. In Europe, spa industry is heavily integrated into healthcare system. And so the link is in there, and by all means, take a look later. Versus in the States, the spa industry became this kind of I don't know, I'm not sure how to explain this accurately. It's its own kind of niche, right? The idea you go somewhere to enjoy something for a while. And that's, in my opinion, is a completely missing the boat. And so the Bernie was one of the first people said, wait a second, it's essential that we create this wellness spa movement as a part of the general wellness movement, and we integrate them. And he was one of the first people who, in essence, kind of went around the world and created this. He has a book, if you care. I mean, it's an outdated book. It's, I think, more interesting from historic perspective than for factual. But he wrote this book, basically. He went around the world and he created list of best spas, and particularly with an accent on health, not on an accent of feeling just well, but an accent is like, how can the spa make you not just feel better, but make you healthier? And I think was the most important and is the most important message. And I hope that in the future that this will be embraced once again. There has been massive attempts over the years, even by places like Mayo and Cleveland, to create the spas inside the healthcare facilities, which I think should be the goal. I think overall, on the large scheme, they kind of failed. I think they probably failed simply for the reality that conservative docs don't want to hear this message. It's too wrong of a thinking that if you go to a massage therapist or if you go to a series of saunas or or bentonite clay, that it somehow can improve your health. It makes conservative medical view accept the fact that it plays an important role, and it's not what anybody wants to hear. It's interesting that Europe embraced this many decades ago. In fact, the reason I'm passionate about this, I grew up in this. I mean, in Russia, we call these things sanatoriums. And I don't actually know if that word is used partially in Europe. I think it does. I think the word spa is English word, and the sanatorium is a kind of an old word. Sanatorium always to me meant healthcare facility. It's not like you have a doctor and you're going there for something medical. And I think that's what Canyon Ranch did. The Canyon Ranch idea, they took that model and they just created it here. And then it kind of took off. And now often when we think of health care spas, we think of Canyon Ranch, right? And it shouldn't be that. It should be a much bigger, much broader term. And unfortunately in US it's highly overpriced. In Europe, there are some places where, like, we went to skiing recently, and we went to, they don't call it a spa, and they didn't call it sanatorium. It's like this large system of heated pools and baths and saunas, and it's extremely inexpensive. It was 28 francs per person for unlimited use. So you just get in and you just stay there as long as you want. You can bring your food, your water, and you can just hang out there. So this is like the concept of idea of making it very accessible. And I think Europe did a very big push for that. I don't know when, but a long time ago. And so Bernie, when he was learning and delivering all this information to the public, he has spent a lot of time in Europe learning this model. And this goes back like 70s and 80s. So we're talking about quite a while ago. And then the Association of US Healthcare Spas actually dissolved because there, believe it or not, there was a very aggressive push in the 80s and mid 90s, and even some in early 2000s. They were doing really well, but then the interest went down. I think because they couldn't figure out the real effective business model, all in all, which is unfortunate, really unfortunate. So I just wanted to, this a little bit of tribute, but also I don't have any particular point with this conversation. I do think it's important that we all establish that model of spa in our own lives, whether that means you're having a regular body work with someone, maybe installing sauna in your own house, maybe creating some kind of finding an access to sauna in your gym, or in finding a local place where you can go to at relatively low cost. So that's another thing. I'm highly, and if I hit someone's nerve here, forgive me for that, but I'm quite upset at how the current model of detox is set up in this country. You're going to go for a 21-day detox somewhere. It's a complete nonsense. It is complete misrepresentation of what actually should be happening. The word detox and this kind of a continuously improving your own capacity to withstand the stressors and grow your own resiliency on every level, that should be every day of your life. It should not be, okay, I'm going to take 21 days once a year. That's just, it's a completely wrong message. It's not bad in itself, but it distracts you from thinking correctly. It distracts you to think that for the rest of the year, you can do whatever you want, or that you don't need to worry about it. You have to worry about it nonstop. And going forwards is going to get a lot worse, because we're going to be faced with a lot more toxins over time. So this need to continuously strengthen the detox capacity. And the spas were always the best for that. The whole idea of the spa was you're going to go and you're going to set yourself for this kind of a whole day of detoxification. And whether you're going to do this once or twice a week, for example, would really be the goal. But that requires that these facilities are inexpensive, that they're available everywhere for everybody, and that's just not the case. And that's especially for minority population, that's a completely non-existing concept, which is sort of pains me the most, because you have money, you're going to go buy whatever. And in Europe, again, the Europe have thought through this somehow over decades, and probably different countries think about this and operate it differently, but things that I've seen on my trips so far have been pretty uniform. You can find this routinely everywhere, and it's common. It's not like it's something obscure, and it's not horribly expensive either. So now there are some kind of good packages here. So like those of you who live in Virginia, for example, you may have heard of this term Spa World, right? So that's a very low cost. I think it's Korean originally by the design. And I think there are two of them, I believe. I've only been to one. You can get them on, what's that called when you get a discounted coupon?
Groupon.
Groupon, thank you. You can buy them on Groupon for, like probably $30-$40 for a whole day, which is quite affordable. Kind of similar to what we paid in Europe. And then you just stay there for many hours and you can do all kinds of things. In fact, honestly, that World Spa was way more advanced than when we were in Switzerland. It was way better. Switzerland, it was simpler. It was much bigger overall facility, and they had some indoors and outdoors pools and saunas and all, but this was much more sophisticated, the spa world. So, you do need to kind of ease into it if you've never done it. If you're planning on doing this, I always recommend to go slow. Start with a little bit and then gradually have your body. And you don't have to do saunas. There are other things you can do. You can do scrubs. You can do, different temperature changes, like cold, hot water change. You can do different pools at different temperature. You can do water massage. All right, that's my sign that I am running out of time. So you know the drill. Put the questions in the chat. We'll take 2 more minutes to answer questions. And no, Dr. Goodman here is for the whole time. He's doing our whole thing today. So Elisa, don't worry about it. And that we thought of that. Okay, I don't see any questions. Then maybe there are no questions, which is fine.
I have a question that I can't type fast enough. So some gyms provide some spa related activities. Does that count? I mean, it seems like.
So I think it does. I mean, some gyms will have regular saunas, right? But it's very, very mediocre usually. You will have like a one sauna, and often showers would be poor quality, and you wouldn't want to be there for like regularly. I mean, we belong to the Silver Spring Y. That's okay sauna. It's a mediocre showers. It's better than nothing, but it's definitely not on par with what I think should be. And frankly, also gyms, in my opinion, not the right places for this. Gyms attract a different category of people. More importantly, you don't go there for the spa. You go there for the exercise routine. All right. Yeah, there is quite a delicious food in there. By the way, that is also different from what I've observed in Europe. In Europe, it's usually just they don't have food inside of there. You have to go out after. But in World Spa,
Misha, I have to cut you off and turn things over to Dr. Goodman.
Very good. Thank you.
Okay. My name is Harold Goodman, and I want to thank Misha and the entire group at the Office of Integrative Medicine and Health for giving me this opportunity to talk. There are basically 2 types of fully trained and licensed doctors in the United States, MDs and DOs. MDs, everybody knows what they are, but some people don't know what a DO is. A DO is a doctor of osteopathy, and about 11% of the doctors in the United States have the DO degree. I'm a DO, an osteopathic physician. I've been practicing osteopathic manipulation, diagnosis, and treatment for 32 years in Silver Spring. And the original school of osteopathy was started in Kirksville, Missouri in 1892. And I went to that school and graduated in 1987, the Kirksville College of Osteopathic Medicine. And while I was there, I did a fellowship in osteopathic manipulation, and I spent 2 years working in a specialty clinic, getting extra training and teaching medical students in the school. Following that, I did an internship at the South Bend Osteopathic Hospital in Indiana. There used to be over 300 osteopathic hospitals because the MDs wouldn't allow us in their hospitals. So we started our own hospitals. And then after that, I came to Washington, D.C., and I did a residency in physical medicine and rehabilitation at the National Rehabilitation Hospital. I've been teaching osteopathy to physicians in practice, medical residents, and medical students for over 40 years. The osteopathic physician is fully trained in all aspects of medicine and surgery. Our training also includes special hands-on diagnosis and treatment, osteopathic diagnosis and treatment. Though osteopathic medicine is the fastest growing segment of healthcare in the United States today, because when I began in 1981, when I entered school, there were 11 schools. Today, there are almost 70. But most of the people who graduate from these schools practice exactly the same as MDs, and they basically give treatment of symptoms. They're not interested in touching people and finding out what's actually going on. There are about 187,000 DOs in the United States today. They're in every single medical specialty, from family medicine to surgery, psychiatry. And over 10% of the armed force physicians are DOs. But of this 187,000, less than 1,000 do osteopathic manipulation and treatment. And this is my specialty. So what is it? What is osteopathy? There are many ways to approach the human body with our patients. And one simple way is simply to see the body as a physical body, the structure, which has function, or the way it works, which is physiology. And this is the basis of a lot of osteopathy. So when you get a good understanding of how the structure is working, you will have an understanding also of the physiology. Now, most medicine works on physiology, not so much on structure, but we are able to influence and change the physiology by working with the structure. It's kind of like a coin. It has two sides, the front and the back, heads and tails, and they're inseparable. And the same thing with anatomy, physiology are inseparable. So what we do is we've been trained in putting our hands on people and using the anatomy, the physical body, as a entree, as a way to actually experience in real time what this patient's body is doing now and why they have all of their symptoms. And then we can, working via the physical body, we can actually change the physiology, the way their body works, and of course, change their symptoms. The other thing also is that the body is alive. The patients who are coming to us are alive. They're animated by the life force. And the body is intelligent. It's not like our enemy doing all these symptoms to make us miserable. It's intelligently doing what it does because it's finding itself in a bind. It's finding itself in a situation where this is the best it can do. If it gives you a fever, it's doing that because it is trying to help you in the situation you're at. All the symptoms that people have are the response of the body to the conditions it encounters. By the way, I'm also including the brain, the mind in this. The body is always looking for balance and harmony. And that's actually what I think all of us want in our lives. We want some balance. We want some harmony. When we don't have it, we're not very happy. When the body is normally functioning, people don't have any symptoms. They're doing pretty well. 60% of your body is nerves, muscles, bones, connective tissue, the neuromusculoskeletal system. In osteopathy, this is our guide. This is our entree to the patient. And I'm going to give you some cases later on to illustrate how I do that in my practice. Osteopathic physicians are trained in how to touch patients, and then we use that information to help them get better. I have a funny story. I think it's funny. GW used to have medical students pick a preceptor that they could spend a year or 2 years with, a primary care physician. And I got a telephone call from the dean of the medical school at GW about 15 years ago or so, saying, we had something very strange happen. And I said, what do you mean? Why are you calling me? And he said, well, I'm Dean Kallenberg. And he said, we had one of our students wants to spend the year with you. I said, oh, okay. He said, we never had anyone who wants to spend the year with someone like you. And I said, well, if you want, I'll do it. And he said, well, what are you going to teach them that we can't teach them? And I said, well, for starters, I'll teach them how to do a physical exam. So the student came here and he was so excited with what he was learning. He said to me, you know, I want to be an osteopathic physician. I said, forget it. I said, nobody will know what you are. They won't even know you're a doctor. I said, become an MD and then you can learn these things. So we have this different approach, and our patients seem to really love it when they're treated this way, and obviously when their symptoms disappear. So the neuromusculoskeletal system is a mirror of the body. It never lies. So you can't hide anything from the neuromusculoskeletal system in your brain and your body. And we treat the cause of the symptoms, not the symptoms, and your body will teach us how to do that. As you know, most medicine today is symptomatic treatment, but this is not the case with osteopathy. And that's why I chose this approach to patient care, and I've done it full time for over 32 years. The other thing that's very important also, and you obviously are getting this with Misha and doctors like him, we listen. You know, you go to a doctor and they'll spend, I don't know, maybe 7 minutes, 10 minutes. I don't know how much time they'll spend with you. I spend 45 minutes for every single follow-up visit. It gives me time to talk with people, to listen, to really get a sense of what's going on. Then I examine their body, and I also listen to the body. It tells me what's going on as well. And finally, I have all of that together, and this guides me in giving a good osteopathic treatment. I'd like to present 3 patients who I'm currently taking care of. The first man, whom I'll call Jay, is a 50-year-old man. He was born in a teeny tiny town in North Carolina, and he has spastic cerebral palsy since the age of 3. What happened was he didn't get oxygen to his brain, and he developed cerebral palsy. He uses crutches to move. You might have seen these kinds of people. They have these crutches, and they can't even stand up straight, and they lurch forward. They just fall forward with the crutches. And one day I walked out to greet this new patient, and I looked at him, and he was all bent over and twisted, and his head was facing down, and I was afraid. I thought, what can I do to help him? I mean, I hope that he doesn't expect me to do anything dramatic because I don't even know what to do. I talked with him. He said it took him 3 hours in the morning to get dressed. He works in the federal government. But this guy from this tiny town in North Carolina put himself through graduate school and he has a PhD. So he's working on a fairly high level in the federal government. The reason he came to see me is because he couldn't sleep because he had insomnia. One of his ribs kept slipping out on the upper left side of his body. And he had been to a chiropractor, and chiropractor would fix the rib, but then it would slip out again over and over. So he came to me. And after the first treatment, the rib stayed in place and he was able to sleep. And as we all know, when you can sleep well, everything is better. He's been to me 10 times. The last time I saw him was yesterday. He told me that this treatment has really been helpful. He's able to ambulate. He's able to move so well now that his body has begun to straighten out. He's no longer bent over. He's no longer looking down at the floor. His head is looking straight ahead. He's straighter. And I remember after one of the treatments, he just looked at me and he said, "I'm straighter." In fact, he's so straight now, he has to get new crutches, since the old ones held him with his face down, bent forward. And now he's able to see the world. He holds his head up. And then he said to me, this weekend I was able, he said, run. I don't know how he can run, but he was able to move so vigorously. He said it was the first time in 5 years that I've had no pain. I was able to go up and down stairs easily, and the range of motion is much better. So this is an example of how osteopathy can help somebody who maybe other doctors won't know exactly how to help them. This next patient, who I'll call R, is a 37-year-old lawyer and economist, and she's come to me 9 times so far. She came because she had a terrible concussion. A bookshelf fell down on her head. This was 4 years ago. As a result of that, she's been living in a dark room all day. For 4 years, she just wakes up and then she just lays in this dark room because she is intolerant to light. And she can't go outside because she can't tolerate sound either. And she's very sensitive to smells. And this is very common after concussion. She can't care for her son. She can't work. She's no longer able to bring in any income. She can't work. She had very, very severe vertigo, everything spinning all the time. And then she had one symptom, which I've never encountered before. She has a severe intolerance to second and third-hand marijuana smoke. The odor, and even just being in a room where someone had smoked marijuana, it produces terrible symptoms in her. And she's had to move many times from different apartments. She's living in Washington, D.C. now, where luckily nobody smokes marijuana. And so she's unable to travel in an Uber, in a bus. She can't be in the metro due to this intolerance of the odor. She's been to many, many concussion clinics. She's seen many experts. She's gotten no relief whatsoever. And she was miserable when she came to see me. She was desperate. She's come for 9 visits. I'm able to put my hands on her. In fact, I had a new patient today who's 10 years old with a concussion. I'm able to put my hands on concussion patients, and I can feel in their cranium the membranes on the inside of the bone called the dural membranes, how they are twisted, how they're even a little bit warped as a result of the traumas and other things from the concussion. Because the doctors who usually evaluate concussions, they might do an MRI, an EEG sometimes, but that doesn't really tell them what's going on. And a lot of times they'll just go by the symptoms, and then they'll tell the patients, well, you need to be in a dark room and relax and so forth. And they go for many, many years without much relief. As of the last time she's been here, 9 visits, she's fully able to tolerate light, sound, and odors. She has no more intolerance to marijuana smoke or the residue. She has almost no vertigo. Obviously, her mood is much better. And she told me, the greatest thing that happened was she said, we used to shop at Trader Joe's and I haven't been able to go for 4 years. She said, at first I tried 1 minute, 2 minutes. She said, I was in Trader Joe's with my husband for 20 minutes. Before that, because of the light, the sounds, the odors, I couldn't even go in the store. And she said, I was laughing with my husband because our biggest problem was to decide which cereal to buy. This is after 4 years, 9 visits. 3.8 million Americans have concussions each year. It's the most undetected and untreated of these types of phenomena, and obviously can have devastating effects. In 2009, according to the CDC, the cost of concussions in the United States was $4.2 trillion. These concussions or closed head injuries are misdiagnosed, and there are no neurologists who can treat them. And I know because I spent 3 years doing a residency in physical medicine rehabilitation at the National Rehabilitation Hospital. And I spent 3 of those months in the closed head injury concussion section. All the doctors there were neurologists. None of them ever touched their patients. Nobody was able to palpate the cranium or feel what was happening as a result of the head trauma. And what was their treatment? The concussion patients were kept in dark rooms until they were discharged, until their insurance ran out. And they didn't get better. There are many physicians who claim to specialize in concussions. They even have concussion clinics. There are over 900 concussion clinics in the United States, and you don't need any special training to run these clinics. But these people who run these concussion clinics can't even feel what's going on in the skull of their patient. Osteopathic training permits me to examine the trauma to the entire system and also with the treatment. The treatment is very specific for what I find with my hands. Honestly, none of my patients, and they come here as a last resort after they've been to these clinics, had any success with these concussion clinics, not a single patient. So concussion clinics is a growing business. Trillions of dollars are being brought in via concussion clinics. Many venture capitalists are making a fortune funding these places. And most prey on desperate patients and their families. So one of my specialties, one of the things I love to do the most is treating concussions because it totally helps the people to have their life back. And I believe that I've been doing this for 32 years, and honestly, I may get one patient with a concussion in 3 weeks or a month because nobody refers any of these people to me because they don't even think about sending them to someone like me. But I will say that almost all of my concussion patients completely recover. Now, I do know something about concussions because I had 3 concussions, and the last one was so severe that I was unable to work anymore. I couldn't drive a car. I couldn't go outside. It was in the summer because the sound of the insects was so horrible that I wanted to run back in the house. My life was totally wrecked. I couldn't watch TV anymore. When the people were talking on TV, the sound was not coming out of their mouths. It was like a delayed thing. At one point, I thought I wanted to kill myself because it was pure torture. I am 100% symptom-free as a result of osteopathic treatment. The next case I'm going to talk about is one that almost every single doctor encounters daily, but they don't understand how to diagnose and treat it. You know, for many, many years, and I've been doing this for over 32 years, I've seen thousands of patients. I always wondered, why do some of the patients keep coming back for the same or similar problems, especially those with chronic pain and headaches and so forth for months and years? I mean, I treat them, they feel better, and then they come back and they say, well, my symptoms were all back. The sad truth is that many patients go from doctor to doctor for years without long-term total relief of their chronic symptoms. Just to give you an example of chronic symptoms, let's take chronic pain. It's a major problem in the United States. According to the AMA in 2019, over $635 billion a year is spent on chronic pain patients. And few of them ever get any real relief. Some of them, they go from doctor to doctor and no one can figure out what's going on and how to help them. And many of them get surgery and they're still in pain. And in fact, there's an official diagnosis for these people, failed back surgery syndrome. This is from the AMA. They say, we did surgery on them. The MRI looked like they should get surgery. And then we did the surgery and they still had their symptoms. So I'm going to give you a case now of how I approach this. And after this case, I'm going to spend the rest of the time helping you to identify what I call mind-body syndromes and how to diagnose them. And then I'll answer questions. This patient is, I'll call him N. He's a 27-year-old man who works as an arborist. He works with trees and a gardener. And he had severe low back pain for 2 years now. He told me in the middle of my exam, by the way, I don't think I told you, I've had lifelong anxiety and obsessive compulsive disorder. He can't bend forward, he can't sit, and yet this is how he earns his living. He's so terrified of moving around. He said, I wish I could be wrapped in bubble wrap. My life is living hell. His MRI, because they all get an MRI, showed that there was a small disc protrusion at L5S1, which, by the way, all of these patients, when they get MRIs, it's usually at L5S1. That, as I shall explain to you, is a normal exam because these abnormal MR findings are found in almost all patients who have no back pain at all. There was actually a study done in 2015 in the Journal of Neuroradiology. It was published, 3,100 patients who had no pain, no back pain at all. They all got MRIs from age 20 to 80. Every single one of them had abnormal MRI findings in the spine. Bulging discs, herniated discs, all kinds of things. And what we've learned as a result is you cannot tell a patient accurately that the MRI explains why they're having pain. But most doctors don't know this. In fact, in the 1990s, the New England Journal of Medicine published another study like this entitled MRI Findings in Patients with No Back Pain. So this patient told me, no one can help me. I've been everywhere. I've spent all my money. I've gotten PT. I went to so many chiropractors. I paid for 3 boats for them. I've gotten injections. I've been advised based on my MRI finding to get surgery. He's 27 years old. He said, almost all my buddies are getting surgery for this. And I said, well, how are they doing? He said, they're still in pain. They've all been told they need surgery. He said, I told one guy, I'm going to this doctor. And he said, well, I'm getting surgery tomorrow. So I carefully examined him. Now, his back muscles were tight on exam. But I've been doing back exams for 32 years with thousands of patients, and I can find out if there's anything wrong with the back structurally, physically. His exam was totally normal. 100% normal. So what do you do with a patient where they're complaining of back pain and the exam is normal? But his pain is real. He wasn't making it up. It wasn't in his head. For 2 years, this pain had kept him afraid to move, and yet he had to move all day long for his job. So I asked him, well, what stresses you out? And he said, well, basically everything. The littlest things stress him out. They trigger his pain. So I said, okay, I want you to stand up now, which he could do, and close your eyes. And imagine you're bending forward, which was one of his triggers for back pain. As soon as he imagined that he was bending forward, he had back pain. So I looked at him and I said, "What does this tell you?" And he said, "Well, you said my exam is normal, and I'm imagining it, so I guess it must be coming from my brain." And I said, "Bingo, it's coming from your brain. There's nothing wrong with your body." And then I also told him, I said, "This is a wonderful diagnosis to have. You don't need to go to any more doctors. And at a certain point, you won't even need to come to me. I'm going to help you so that you're going to be pain-free. We're going to reprogram your brain. We have ways of doing this. And I've been trained in this. And I'm up on the very latest research and things on how to do this." He suddenly realized his brain was creating his pain. The physical exam was normal. The MRI was what we call a normal abnormal finding. The only thing left was that the brain was making the pain. Now, all pain in the body has to go via the brain, whether it's physical or not. If you fall down a flight of stairs, you're going to have pain. The brain is making that pain. But what happens if after 5 months or so, you're still having that pain? That's chronic pain. And after about 5 or 6 weeks, all acute pain, the pain that you had while you were falling down the stairs or something like that, is healed. What remains is chronic pain, and all chronic pain. And this, most doctors don't know this. All chronic pain is coming from the brain. And this is about 40% of the population has this. The pain is real, but it's triggered by stress. It's not from the body. What we have to do is you have to get a really good structural examination by a doctor who touches you and can feel things and say, "The exam is normal. I can't find anything in your body, nothing structural, that's causing the kind of pain you're talking about." Then we realize it's got to be a mind-body syndrome or a brain-generated pain. He sat down after he did this, and he started squirming around. And I said, "Why are you moving all around?" He said, "I don't have any more pain." And I said, "Well, how am I going to make a living if you have no more pain?" He started laughing, and he realized what had been fooling him this whole time, the idea that his brain, because he was so stressed out much of the time, was creating pain. And everybody thought it was coming from the body, even the person who wanted to operate on him. But the pain's real. But then the body exam is normal. So we have to conclude the pain is coming from the brain, since that's what creates all pain. Now, the man who discovered all of this was a man named John Sarno, MD. He was at New York University. And I went there in 2010 and studied with him. He's the grandfather of all of this mind-body syndrome pain. I came back to Maryland 10 years ago, and I've been treating patients when I find a normal exam and I find the stresses and triggers and other things this way, and they get better. But a lot has been discovered since Dr. Sarno lived. He died in 2017. We have many other ways to help these patients, and I'm getting continuous training in them. In fact, there's a doctor in Michigan, Harold Goodman, MD, who I recommend you look him up on Amazon, and he wrote 2 books, Heal Your Pain, or Unlearn Your Pain, and Unlearn Your Anxiety and Depression. Because all of these chronic brain-generated things are accompanied by anxiety. And in fact, and this came as a shock to me, but Dr. Schubiner and his colleagues have done quite a few studies and treated the patients and helped them with this. All anxiety and depression unless it's coming from things like hypothyroidism or hypothyroidism or different kinds of medical disorders, certain tumors, is actually mind-body generated. Most of these patients have complete recovery after years of no relief. So as I said, this is 40% of the population and almost 100% chronic pain and other chronic non-responsive conditions where the example is normal. So what are some of these conditions that we found basically are being generated by the brain in this 40% of the population? Mind-body pain and other symptoms, chronic back pain, chronic headaches, irritable bowel syndrome, chronic fatigue syndrome, a lot of food intolerances, anxiety, depression, fibromyalgia, long COVID. In Portland, Oregon, there is a physician there, Rebecca Kennedy, MD, who specializes in treating long COVID. She's treated thousands of patients, and she's getting almost 100% recovery using mind-body medicine, interstitial cystitis, pelvic pain, and over 40 other diagnoses. There is abundant literature documenting these things. You're going to get a handout later on. It's a questionnaire. It's from the Psychophysiologic Disorders Association, ppdassociation.org. If you go to that link, you will find a tremendous amount of resources. You can educate yourself. Unfortunately, even now that we've been doing this for 30, 40, 50 years, not a single medical school residency teaches any of this, not at all. So again, my own tie-in. In 2021, I began to have this type of back spasm. It was horrible. It was always followed by intense anger. It kept coming back. When I was really stressed, my back pain would come back. Finally, in 2023, my back was so spasmed, I missed work. I couldn't get into or out of bed without help. I was in so much pain. And to compound that, my left foot was excruciatingly painful and I could hardly walk for 6 months. It all went on for a really long time. And let me tell you, and some of you know this, I'm sure, when you are in pain like this, your whole life basically is worthless. And the people close to you also have to suffer. I saw so many specialists for treatment without results. I went even to New England. I went everywhere. I spent a lot of money. Finally, I said, Harold, this is okay. I see there's a comment put in chat. You're going to get a questionnaire that's going to have the link to this. I finally thought to myself, you've gone to all these people who have treated you in the past when you had an acute injury, and you got better immediately. Why are you not getting better? And I said, duh. What do you think you've been doing with your patients for all these years? It's mind-body syndrome. And I can tell you this. Once I started applying these principles to myself, my pain is totally gone. And I might add, my chronic anxiety, which I've had for 75 years, is gone. And that was actually amazing. I never expected the anxiety to go, but the anxiety accompanies this. Okay, now, I haven't been looking at the chat so much because I'm trying to concentrate on the handout, but there will be time for questions after this, and I would love to hopefully try to address your questions.
You want me to give them the handout now or wait?
Wait. And the reason I want you to give the handout later is because I want the audience to pay attention to these questions. These are the questions, and I want you to just answer for yourself, yes or no, for each question. Has your doctor completed diagnostic testing without finding a definite cause for your pain or illness? If your physician believes your symptoms are caused by organ disease or structural damage, and you're not improving, the answer, you're not improving as they think you should, the answer is yes. And again, keep in mind, healing of most physical injury is complete in 6 weeks. Longer than that is chronic. Have you had more than one symptom for longer than 6 months? Are your symptoms located in different areas of the body, or do they move to different locations? I would have people come in here for back pain, and I would treat them, and they'd say, well, the pain on the left low back has now gone to the right. I never thought about it. That's exactly what this is. It's mind-body syndrome. The brain is making the pain move all over the place. It's part of the syndrome. Sometimes the pain or the symptom will be worse in the morning, worse in the afternoon. It changes. This is mind-body syndrome. Are your symptoms increased by stress or thinking about stressful situations? Like with our patient, this is mind-body syndrome. Would you describe yourself as a highly detail-oriented, highly self-critical perfectionist, or do you routinely put the needs of others ahead of your own needs? This comes from childhood experiences, which we go into when we're helping patients with this. You learn that your best effort is not good enough. And fortunately, this can all be treated. Are the people who caused stress for you as a child still active in your life? And then we teach you how to set boundaries and deal with that. Have you experienced a significant amount of stress in your life recently? High levels of stress are common in people with mind-body syndrome. Symptoms often improve when the stress is reduced. So I had a patient today, she's 14 years old, horrible headaches, horrible back pain, excruciating, crying in the office. She goes on vacation, she has no more symptoms. In the last 2 weeks, have you often felt nervous, anxious, or on edge, or have you been unable to stop or control worrying? In the last 2 weeks, have you often felt little interest or pleasure in doing things, or have you felt down, depressed, or hopeless? I mean, when you have this stuff, you're anxious and you're depressed. Did your symptoms begin soon after a terrifying or traumatic or horrifying event, or after a triggering event that is linked to the trauma? If you learned that a child you care about was experiencing everything you did when you were a child, would you feel sad or angry? That last one, by the way, is really important. You went through what you went through as a child. How would you feel if some other child that you really love had to go through the same thing? And if you find that difficult and you have these symptoms, that's a red flag for mind-body syndrome. So what I did today was briefly introduce you to osteopathy. I could obviously talk a lot more about it. I gave 3 recent cases where my osteopathic medical training helped me diagnose and treat the patients. And most of my patients have physical or structural causes, and usually within a few treatments, they go away. But a significant number of patients who have been to many doctors and other people and not gotten relief end up in my office. Most of these have mind-body syndrome, and after exam by a physician rules out physical or structural problems as the cause of their symptoms, they often get better with the mind-body approach mentioned. And now we're ready for questions, and everybody is welcome to the handout as well. Any questions?
You can unmute yourself to ask questions if you don't feel like typing it in the chat box.
Yeah, but I won't see the chat box, so it's best to unmute. I will see. I'll look at the chat. I'm looking at okay, I'm looking at The name of the books is Unlearn Your Pain and Unlearn Your Anxiety and Depression by Dr. Schubiner. Oh, somebody put it in there. That's great. So
When you
those,
click on the box, it requires passwords and stuff.
okay. Well, anyway, don't click on the box then. Just write it down. Any questions?
Jen was referring to the handout.
Oh, okay.
Let me make those changes.
Well, in the meantime, does anybody have any questions, comments?
Could you repeat the last question again, please?
The last question that
That you were asking, the last of your series of questions.
oh yeah, that's a good one. That's my favorite one. And that's actually the one that we often get the most response to. You went through what you went through as a kid. You had to live with your parents in the situation you were at. A lot of times the home you lived in was not the easiest place for a very young child or anyone to live. Wasn't even easy for your parents in some cases. How would you feel? Because we have patients who say, well, that's all well and good, but it doesn't affect me. I'm not like those people. Well, say you had a child who you really loved and you put them in that home where you lived and they had to live there. Would you feel sad or angry? Because that's what you went through. And that sadness and that anger is what your brain is remembering. Whenever you get stressed, it's remembering that and it's afraid that you're back there again. This is what the unconscious mind does. Is that helpful? Any more questions, comments? You can unmute yourself if you want to say or
Hi there,
comment.
Dr. Goodman. Thanks so much for this talk. I was just curious if you know that there are any places that are currently training medical students, MD medical students, in osteopathic manipulative medicine. Yeah, right now.
Okay, that's a good question. Yes. What I suggest you do is, what is your name?
My name is Sharad. Hi.
Okay, Sharad. Well, Sharad, first of all, go to my website and get my email and send me an email and I'll send you those some suggestions. Yes, we do train MD students, allopathic students in this, and we're happy to help you in any way that you want.
Thank you. I'll do that.
Great. I look forward to hearing from you. Anything else? Anyone else? Just unmute yourself. Well, if there are no comments,
Would it change things on the last question about going through the same childhood? Would it change things if you asked it as an open-ended question instead of asking them if they would be sad and angry? How would you feel about that child going through your experiences? Would that change it?
I don't know, but I think that's a great thing to do. You know, basically, this is not set in stone. This is not the only one way. We're learning how to do this. And like I said, you know, there are very few doctors who are interested in doing this because, as my husband told me when I told him what I was doing, he said, "Are you crazy? You're telling people they're okay? How are you going to make a living?" So there is very little financial incentive for doctors to do a lot of this because we don't have to see the patients a lot. Once we get them started, we check in with them and so forth. But to go back to your question, why not? Try that. The reason that we have it this way is because we find out that most patients are sad or even more so, very angry. Even Dr. Sarno called it rage. And we're not allowed to be angry at our parents, especially our mother. And we find out that when we go into this, there's a tremendous amount of anger there. But our brain will not allow us to do this because we feel we're betraying them. We shouldn't do this and so forth. And that makes us even more angry. Is that helpful?
Yes, thank you.
Okay. Yeah, I love these questions. Everyone's asking great questions. If you have more questions, ask them, because otherwise I disappear. Okay, well, people should tell me when.
Do we have, Harold, do we have the way for people to get in touch with you if they want to see you set up somehow?
I don't think it's set up.
I'll add it to the chat, but there's also a link to Dr. Goodman's website in the email that I will send in a timely manner this afternoon.
Thank you.
Fantastic.
But I found the link too, so I'm going to put that in right now in the chat just for everybody. But thank you, Dr. Goodman, so much. Maybe we'll see you soon at some point.
Listen, I would love to come back and talk some more and hopefully answer questions, because I've been doing this for 32 years. I've learned a lot, and I would like to share all of it with you. And the reality is that I didn't know these things when I was in medical school, and I've learned things, and I want to just share it with you guys. So if you invite me back, I can share. I mean, I could do a whole presentation on concussions, and could do one on mind-body syndrome, could do one on a million different things.
Well, wonderful. So we'll have you back in no time. Meantime, I think I'm not here next week because we're Dr. Frame and I are at the Consortium of Academic Health Centers meeting in Cleveland. Hope everybody enjoys the eclipse on Monday. Should be able to see some of it here. Much better in Cleveland. So excited. And Janet, who are we having next week? Layla
Kenny, who is a psychotherapist, yoga instructor, and board member of Circle Yoga Cooperative.
Great.
Will be with us next week.
Okay, and if you guys have questions, I'll hold them for the week after when I'll be with you. I will try to join, but I think the chances are very low. I'm presenting something right before. I doubt that I'll be able to jump on this video, but if I can, I'll be here. So if you see me, don't be surprised. Wonderful weekend, everybody. Again, Harold, thank you so much. Absolutely lovely to have you here. Such a wonderful talk today. Absolutely delightful. And do want to acknowledge Elisa Parker for making all the needed connection and sort of facilitating this to happen. So thank you. Bye, everybody.
Bye, everybody. Have a good weekend.
Okay, bye-bye.